Hi there, this is Dr. John Whitcomb talking about prolonged fasting for high blood pressure. High blood pressure, a little bit of context. At age 70 in America, 70% of Americans have it. As we get older, it's just almost taken for granted that we have high blood pressure. So the majority of Americans should be on high blood pressure medication. In fact, recently it's been recorded that 130/80 is actually the threshold that's worth treating to instead of the old 140/90, and that the side effects of all that extra medication is worth it because of the reduced mortality. And our treatment of high blood pressure has been one of the miracles of modern medicine. It has dramatically participated in reducing the incidence of coronary artery disease. Well, what is high blood pressure? It's being rethought of as endothelial dysfunction. That means the lining of your blood vessels are annoyed. And when they're annoyed, they clamp down. If you think of your body as being like a water balloon, you only have so much volume you can hold. And when you clamp down on that volume, the pressure rises. Whereas if your blood pressure vessels relax, like a water balloon, they get softer and your blood pressure is lower. It's a little more complicated than that. There's actually quite a few more nuances and details, but that's pretty close. You know, insulin plays a part, for example, and dramatically forces you to hold on to sodium in your kidneys. So if you get rid of insulin by not eating insulin-inducing foods, your kidneys don't hang on to so much salt. And then you lose pressure and you aren't forcing so much water into the system. But what's the evidence we have to support this? We now know that there's been 2 research studies, one of which 174 people were put on a prolonged 10-day fast, and at the end of that were all off their high blood pressure. Dr. Goldhammer reports, Joel Furman reports his private communication with the Dr. Goldhammer, who reports on 51 people with an average blood pressure of 140/90, given a 10-day water fast, and 10 days later are 100% off all medication. More notably, 6 months later are still off all medication. Isn't that interesting? What's going on? We think what's happening is that, in fact, there are many foods that our gut finds objectionable. We evolved as a species in Africa eating African foods, green plants. 5,000 years ago, we started eating grains when we learned to farm and started settling down in cities and learning language and developing kings and armies and taxes and iPads. And civilization's been kind of fun. But it has some side effects, and those foods they constantly irritate us at a low grade perhaps. Dr. Stephen Gundry talks about lectins, and I suspect that's part of it, if not most of it. In any case, we end up with high blood pressure. Take those foods away, and the 70% of your immune system that's basically ended up settling around your gut to fight all the crazy foods you're eating gets a break and can relax and stops putting out inflammatory cytokines. Takes it for a couple days for it to notice, but once ketones show up, it starts being happier. And 10 days later, your blood pressure's gone. What will work for me? I have just personally seen a person with accelerated hypertension with a blood pressure of 220/120. I was personally called from the academic medical center saying, "Will you see him today?" His blood pressure dropped 22 points off of all medication after 4 days, and after 6 days his blood pressure was in the normal range. This is stunning. This should be offered to everybody with hypertension. It's not that fasting for 10 days doesn't take intense support. It's hard work. It's like being in the ICU. But it works. What will work for me? Well, I do a 5-day fast every month. I'm planning on doing a 10-dayer this January. Want to join me in it? This is Dr. John Whitcomb with News and Nutrition. Fasting cures high blood pressure.